program has been running for 16 years. We are seeing a progression in the acceleration of medical interventions.
EDCTP 3 definitely should build on its strengths, and strengths are working in partnership, investing in the institutional capacity of African research institutions, but also making sure that it continues to be driven by real-world questions. What are people dying from? What are they suffering from? And that's what should determine the agenda.
We can say that EDCTP have contributed a lot to strengthen the research capacity in Africa. But if I take an example of the impact of EDCTP funding in Gabon, we start from the scratch to the level where today we are ready to run a clinical trial for TB vaccine and TB drugs in Gabon.
I think the model that EDCTP promotes emphasizes inclusion and diversity. The ideas are being driven by the scientists from Africa.
I think continuing to build that capacity, to continuing to fund fellowships that help to develop young investigators, ultimately that must be the goal, that all of these trials are conceived and run out of Africa with much less European engagement.
I think typically you would say that it builds capacity for the South, but I would claim that it also builds capacity for the North. Because the value of research is not geographic. The value of research is universal. We can build on that.
EDCTP should be close more than ever to the community in endemic area. And also to try to break the barrier. They have to break the barrier of language.
I would say in the past, there was a bit of barrier between academia and private sector to collaborate. I think we are overcoming this. EDCTP is a great platform to really give us this opportunity to collaborate more. So really for EDCTP 3, my expectation is that the private sector gets involved even more than we do right now.
I think EDCTP 3 has a chance to expand to global health partnerships that go beyond the obvious infectious diseases. There are major epidemics of other things, non-communicable diseases, hypertension, the comorbidities with infectious diseases that we need to be looking at.
I think the great thing about EDCTP is that it really has changed the game.
We need more commitment from the member states that we are working with, and more political and financial commitment from the African partners, from the European partners, and from the global partners.